Señor Secretario General José Martínez Ramos, distinguished guests, delegates, buenos días. First, I would like to thank the Spanish Ministry of Health, Social Policy and Equality for their warm welcome and for hosting this event. It's my honor and pleasure to stand before you today in the first open forum in the European Partnership for Action Against Cancer. This forum brings together members of the partnership and European stakeholders active in the fight against cancer. It is important to underline that we can achieve the high goals we have set in this field only if we act together. The main goal of our Partnership for Action Against Cancer is that incidence of cancer cases should be reduced by 50% by 2020. In the true spirit of European community, we are gathering together to review what we are doing and how we can best achieve a common objective of reducing the cancer burden. Cancer and its ever-increasing burden can improve if the European Union works together to solve the complexities underlying this disease. In Slovenia, we believed that in 2008, and we are still convinced about this. In June 2008, the Council of European Union Health Ministers adopted conclusions on reducing the burden of cancer, demonstrating a political commitment to fight this serious disease. I will just point out three elements from the conclusions. First, the invitation of the European Union member states to develop and implement national cancer plans. And as you are aware, this is a key area for action within the European partnership. The second aspect is the comprehensive approach that was highlighted and includes disease prevention, early detection, high-quality treatment, psychosocial support, and palliative care and research. The third conclusion that I would like to stress involves the Commission, which was invited to present a European Union action plan on cancer addressing all aspects of cancer control and to consider the appropriate framework for effective cancer control policies and sharing expertise. Thereafter, the European Partnership for Action Against Cancer was born out of the Commission communication on action against cancer. This communication of 2009 outlined the skeleton of the partnership. The thread underlying the Commission's idea was synergy, a collective approach to cancer, one of the major health threats in Europe. By pooling all the resources available within the European community through sharing information, exchanging expertise, learning about best practices, we will establish an approach that will enable a much higher level of effectiveness as it could ever be reached if we would work separately. The main premise of the European Partnership for Action Against Cancer is that it is a collective effort. Only through using the synergies available within our community we can avoid duplicating our efforts. Excellent examples of this are in the fields of cancer health care and research, which we will be focusing on during this event. We know that there are considerable inequalities in health care for cancer patients throughout the European member states. But we are also aware that these inequalities can be reduced. As the Commission has stated, it is feasible to anticipate that inequalities could be reduced by 70% by 2020. The partnership aims to identify and assess the best practices from across the entire spectrum of European health services, focusing on the patient's perspective. This goes in hand with harmonizing clinical guidelines and raising awareness of psychosocial and communication skills among healthcare professionals, which can be done by creating and implementing a common training strategy. Similar to the importance of improvement of conditions of patients today, it is important to look to the future and provide future patients with optimism in the form of more information, advanced drugs, and therapies available. We commonly refer to this as a cancer research. In the past, research throughout Europe has been scattered. The partnership aims to lessen the isolation of research efforts. The goal is to develop a mutual approach to research throughout the European Union with the ultimate aim of achieving coordination of third of research from all funding sources by 2013 for selected areas of cancer research. The partnership has indeed set itself high goals. But it's important to remember that these goals are achievable. We can achieve them by working together when health experts from all over Europe can share information and contribute to the improved health not only of their nation's citizens, but of the citizens of Europe. Thank you for your attention, dear ladies and gentlemen, and I wish you 2 very productive days at the first open forum of the Partnership for Action Against Cancer. I'm confident that the discussions and exchange of views will inspire us all to work closely in the coming years on combating cancer together. Thank you very much.